Hello everyone. Coccidiosis is one of the common causes of diarrhea in cattle, especially in calves. Coccidiosis is a type of parasite on animals, found widely in cattle such as calves, causing reduced output and economic loss for livestock farmers. To learn more about coccidiosis in calves, as well as how to handle, prevent and treat, please join us. Firstly, about cause. Coccidiosis in calves is also known as red dysentery, caused by coccidia of the genus Eimeria. Calves become infected by eating coccidiosis in fresh grass or stagnant drinking water containing pathogens. The disease often occurs in the summer, hot and humid months, in damp grassland areas, especially in years with lots of rain. Hot and humid weather makes the oocysts easily develop to the susceptible stage. Secondly, about symptoms. The incubation period is about 1 to 2 weeks. The animal may have an acute or chronic disease. Acute illness. Calves have fever, trembling, and have diarrhea that is watery, mixed with blood, and muddy. Every time the animal defecates, it bends its back and pushes, but passes very little feces. Not eating, losing weight, being extremely thirsty, drinking a lot of water and possibly dying within 48 hours between seizures. Chronic disease. When calves have high resistance, the disease will manifest in a chronic form. They get sick when they have diarrhea or constipation, and their stools often contain mucus and blood. The animal is emaciated, weak. Thirdly, about treatment. When detecting the first symptoms of a sick calf, farmers need to isolate and treat it as soon as possible to limit damage and more severe progression. If the animal has severe diarrhea, people need to supplement water, electrolytes, increase resistance and compensate for energy, so the animal can recover before using drugs to kill coccidia and subsequent diseases. To use special medicine to treat coccidiosis, people can use one of the following medicines: Dilacoc 25 oral or Intracox pump or Toltrazil oral. Use electrolyte and vitamin pills to supplement electrolytes, vitamins, improve resistance, increase energy, and prevent acute dehydration. Electromics WS or Vita C 20%. Use GCKC or Actamin KC to stop bleeding in case of bloody diarrhea. In case of superinfection, people can combine with the following antibiotics: Biocillin 150 liters A, Biogenta or Floline LA. Supplement for combined drinking to nourish the liver and kidneys, such as Hepasol oral or Intertonic oral. Use live digestive enzymes such as Trispro, Haspro, mix into drinking water, detoxify, and help restore beneficial intestinal microflora for animals during treatment. You need good nursing and care. Finally, about prevention. People should perform good disease prevention hygiene procedures including clean feed and drinking water. The barn is clean, dry, and airy. Periodically disinfect the barn. Use iodinate or Dexin Super sprayed on the surface of barns and livestock equipment. Incubation destroys oocysts. Drain flooded paddocks and sprinkle lime powder. Use anticoccidial drugs to prevent infection. In areas where the disease is endemic, it is necessary to use drugs periodically every month to prevent infection. Take good care and nourishment of calves to improve disease resistance. We hope today's video on coccidiosis in calves can help farmers have more useful information in preventing and treating it properly, effectively, and economically. Goodbye and see you again.